Hey there guys, so within golf, the number one injury associated with golfers is back pain, specifically lower back pain. Now there's a couple of different reasons why this is the case. It's not often as a result of the actual movement of the golf swing itself, but more often due to the biomechanics of the body. So this can come down to a few different things. It can come down to the stability of areas around our hip or into our core or upper body, or mobility issues, so restrictions in terms of the range of motion that we have through these specific movements that we need for the golf swing. So the two areas that we're going to focus on today are both into the back, but primarily in and around the lower back. So one of the things that we know that we need to have during our golf swing is a separation between your upper body and lower body. So what that means is having your lower body, your hips, move and rotate independently of your upper body. Now if this is not working, if we don't have stability or mobility to perform this movement, then we can get aches and pains and discomforts into your lower back as a result of that, due to various different forces that should just be taken through the hip movement as opposed to being taken by your lower back. So I'm going to demonstrate that for you just now. Perfect. So what you're going to hopefully look to see is being able to keep your upper body nice and stable while seeing your hips move independently of the upper body. So it's going to look something like that. So the upper body is nice and stable, but we're getting nice rotation into the lower body. So if we don't have that ability, all of a sudden we're getting a lot of rotation and movement into our lower back, which puts a lot more stress on the muscles, on the tissues, on your spine as well, on the vertebrae. So this is a really good exercise that you can use to just try and encourage that independent movement of the hips to the upper body. So hands onto your chest, and then just looking to start rotating the hips left and right as you would do in a golf swing without the movement of your upper body. So the second thing that we were really looking to get a good control over when we're thinking about core stability and movement of our hips in relation to back pain associated with golf is control through anteriorly and posteriorly tilting the pelvis. Now, through portions of your backswing, we are looking to anteriorly tilt the pelvis to get into that rotated position, and then as we come down through the downswing, that actual position of your pelvis posteriorly tilts just to get that side flexion, to get through the ball and get a good rotation. Now if we're not doing that, if we don't have the actual ability to perform the movement or perform it with good quality or control, then that's where we can look to get, that's where we can see poor rotation and then poor movement mechanics through our swing, which leads to back pain. So a really easy exercise to help correct this movement is by getting into a sort of shoulder width position, relatively sort of 5-iron posture, so setting yourself up into this position here, and then hands onto your chest, and then what you're looking to do is tuck your sort of belly button towards your spine, lifting your pelvis posteriorly, and then arching your back into an anterior tilt of the pelvis. So good quality of movement through that exercise is really important for good control and stability through the golf swing. So both of those aspects there are things that can potentially contribute to back pain associated with golf. So it's not to say that just by fixing those two things, all of a sudden your back pain is going to go away, but it absolutely will help with the rotation and control that you have through the golf swing, ensuring that everything's working a little bit more smoothly and more in unison. So give those a little bit of a shot. If you have any questions at all, we are now doing the golf screening assessment here at Move Freely. I'd be more than happy to give you a hand or answer any questions that you might have. Thanks.